Hi, y'all. I'm Isabel. I'm the new health coaching intern at BeWELL, and I am here just to tell you a little bit about this service of free health coaching to health professionals and if it's the right fit for you. So, first of all, what is health coaching? Health coaching is where we help to support you as you create goals, seek purpose, establish and live in your values and strengths, and access your own intrinsic motivation to build long term well being. So if you look to the left, this is our well-being wheel, and it kind of helps you to understand that health is not just physical. It's also emotional, it's spiritual, it's social, and all the other aspects that you might consider to contribute to your health, well-being, and happiness. So some topics that you might bring to health coaching could be stress management, self-care, sense of purpose, navigating health and life changes, any barriers that you currently have to change, and much, much more. So how does this work? Health coaching is effective because it's client-centered, which means that you're going to get the opportunity to speak a lot, to explore things that are going on in your own health and well-being journey. And I help to support you in who you are as an expert in your life. I also use an understanding of stages of change. So it's super important that I meet you where you are at, whether that means that you might be establishing that change in 6 months, or you might be ready to do it yesterday. Lastly, just as the well-being wheel shows, we take a holistic approach, knowing that health is not just physical, but it includes all the different aspects of your life, and any of them are appropriate to speak about in coaching. So here are just some of the benefits to coaching. First is accountability and goal setting. Second is being heard or seen. Third is taking time to prioritize yourself in a busy world by using or establishing greater self-care habits. And lastly, problem solving and navigating barriers. There are obviously plenty more benefits, and I'm sure that you can think of a few more. So why coach in the BeWELL setting? Well, first of all, I think it's super important that you, as a health professional student, learn to care for yourself just as you are caring for others. As we're noticing in the clinical setting is that people are getting burnt out. And so establishing your own boundaries, your own self-care routine is super important for your longevity in your career. It's also a great time to navigate self-care, especially because school is such a busy and maybe stressful time of your life. And so why not start these habits now? And lastly, it's to experience what will hopefully arrive as a role that you will work with in your care teams. So the idea is that within a few years, insurance codes will be available for health coaching, and we might be in a clinic near you. So just as I was just saying, it's super important for you to get an understanding of what coaching could look like in a conventional healthcare setting, because the hope is that it is going to help both take the burnout off of the current healthcare system, and it's going to be impactful for the clients or for the patients that you see. So the idea is that we're bridging the gap between what our healthcare system currently looks like and what a more sustainable healthcare system would look like for the future. It's going to minimize burnout for you, the staff, and hopefully decrease healthcare costs over the long term. And for the patients or clients, it's going to help them get more connected to their care teams. It's going to offer them the space and time to ask questions, to problem solve any barriers, to creating new goals, to offering themselves change in their life, and it's going to help them feel seen and heard. So a little bit about me. I'm a coach in many different capacities. I live in New York City, and I am a track coach for a varsity sport, which is really exciting. And I'm also a coach as a yoga teacher at Core Power Yoga, but also as one of the head trainers for our new teachers. And something that really brought me to coaching is that I experienced my own health challenges during the pandemic. And it took me kind of creating my own care team to really help figure out how to eliminate those barriers to wellness and instead promote happiness and healthiness within my life. So my coaching style is grounded, and I like to use our time together to establish an intentional and mindful space where for these 30 minutes, you really get to focus on you and what you want in your life. I also hold positive regard for you as the client. And so I see you as unique, I see you as whole, and I see you as the expert of your life. And lastly, I am goal-oriented. And while not every session has to be goal-oriented, some are really exploratory, but it's fun to create feasible goals that you can use over the long term instead of just short term. So, if this is something that sounds interesting to you, this is what my schedule looks like for the semester. First, you're going to fill out an interest form. Then you'll have an initial session with me, which is 10 to 15 minutes just to get to know each other and for you to ask any other questions that you might have about coaching. Then lastly, we'll have 4 to 5 coaching sessions, which are 30 minutes each. And that's really an opportunity for over a month or two creating some change in your life that you've been wanting and to really prioritize your health, happiness, and well-being. So if you have any questions, you're more than welcome to reach out to me at the email on the screen, or you can reach out to Chip or BeWELL. Thanks.